The estimates are big. The Congressional Budget Office says as many as 12 million people could lose health insurance due to Medicaid cuts in the big, beautiful bill. Another estimate from Democrats on the Joint Economic Committee minority puts it higher when this aspect of the bill takes effect at the end of next year. Just before the big, beautiful bill passed and was then signed July 4th, House Democrats, including New Jersey's Frank Pallone Jr., stood on the Capitol steps to rail against it.
I know the Republicans are saying constantly that nobody's going to lose their health insurance if they work. That is a complete lie. That is a complete lie. If you look at this bill, whether you're disabled, whether you're caring for an elderly, whether you're caring for your children, you are not going to qualify for the exemptions, and you are going to lose your health insurance.
The Trump administration insists this is not true. Throughout negotiations, though, on the bill on the Senate side, even some Republicans had some concerns about cuts to Medicaid, including Missouri Republican Josh Hawley. He was eventually assuaged of some of those big concerns, but Senator Tom Tillis of North Carolina was not. Speaking on the Senate floor, he informed his colleagues he had asked for some studies to be done in his state about what might happen if this bill passed, and upon hearing the results, said he couldn't vote for it.
So what do I tell 663,000 people in 2 years or 3 years when President Trump breaks his promise by pushing them off of Medicaid because the funding's not there?
Over the years, Medicaid has consumed a larger and larger share of the pie. In the mid-1980s, Medicaid took up just over 9% of our healthcare dollars. Now it's double that.
The biggest myth that is being perpetrated on purpose, obviously for political reasons, is that there's going to be a whole-scale removal of Medicaid as a social platform, as a social safety net for the nation.
Dr. Mehmet Oz is the director of the Centers for Medicare and Medicaid Services and a former heart surgeon.
I'm here to say it loud and clearly that 60 years ago, literally exactly this month, 60 years ago when Medicaid and Medicare were created, they were sacred, and they still are. And these programs have remained the backbone of the social safety net of this nation. However, once in a while, you have to update the system. And the president said very clearly he wants to love and cherish Medicaid, but there's so much fraud, waste, and abuse. We need to address that to keep the system viable. So again, Medicare for older folks not being touched. Medicaid for people who are having financial issues is designed for the young, the old, and those who are disabled. That's not going to change. That all stays exactly the way it was when it was created 60 years ago. However, over the last 10, 15 years, there's been the addition of able-bodied individuals on the Medicaid who are having a problem in their life. And so for short-term periods, that was understood. But now we've created a generation where it's people believe they can sit at home, watch television, or just hang out for 6.1 hours a day, which is the average, and still get full health insurance through Medicaid. And that creates all kinds of issues. And layer on top of that, the problem where states know they can game the system to pull down more money from the federal government so they don't have to deal with issues like who pays for the illegal immigrants in California. We've decided to take seriously what the president offered during the campaign, which is to take care of fraud, waste, and abuse. And by doing that, we upset the Democratic Party. But the foundations of the system are stronger, and we're putting, listen carefully, $200 billion more dollars into the system over the next 10 years and making a $50 billion investment in the infrastructure to transform healthcare so it can keep up with the 21st century, because it's fallen behind otherwise.
I want to ask you about a friend of mine, given what you just said. She's a nurse. She's now a healthcare navigator. She helps people with insurance and Medicaid, Medicare, all of it. Full disclosure, she is largely a supporter of President Trump. She wrote me after the big, beautiful bill passed that she has two clients right now. A woman in her late 40s who is bedbound with severe contractures, cognitive impairment, frequent medical crises, and a man in his early 60s who suffered a stroke less than a year ago. She says he's now physically and speech disabled. She says even though they're both clearly disabled, the Social Security Administration continues to deny them. She says that's a pretty common experience for her, that it is very difficult to get disability. These are two people who do not qualify for Medicare yet due to their age, but she says they can in no way work. What happens to Medicaid for people like them?
Both those individuals you mentioned, and my heart goes out to them, should be on Medicaid. The program was designed just for people like them. We will have enough money for people just like the two individuals that your nurse friend outlined, because we're going to make sure that we don't allow fraud, waste, and abuse to take place. So the whole reason we're making these difficult decisions is to take care of those two individuals. But here, listen, this is a really important point. If you're an able-bodied person on Medicaid, based on a rule made last year in the Biden administration, you can pay 3 times more to the doctor that you're seeing than the doctor taking care of those two people. 3 times more than a Medicare patient doctor is reimbursed. Is that right? Think about this. Medicare is for people who worked their whole life, put money into the kitty, and now it's a shared responsibility. They get into retirement age and they want to be able to see a doctor, but their doctor gets paid 1/3 what an able-bodied person who's not paid into the system, who's given Medicaid as a support just to get them back on their feet again. And that's one of the problems we corrected in this law. And I think that's when people understand what the law really has in it, they begin to cheer for it. This is why it was so infuriating to hear Democrats, without reading the law, start making up stories about what it might do. The work requirement is another example. It's much more than a work requirement. It's a community engagement requirement. We're saying, listen, you got more things to do with your life than sit around watching television. We're going to encourage you to get out of the home. We're going to provide tools to help you find positions. We're going to get you to get into an education if you want, go volunteer somewhere. If you can get a job, that's even better. But we're not throwing you off Medicaid. We're offering you a deal. If you try to help yourself, we will help you. If you're not willing to do even the slightest thing for yourself, then we got bigger things we got to talk about.
On the fraud part, you recently announced with the Justice Department this huge case, over 300 people involved in Medicare and Medicaid fraud, about $15 billion worth. Someone at the press conference was telling a story of a transnational gang based in Russia with operators working across Eastern Europe. They took in most of this, I think it was $10 billion in American taxpayer dollars through Medicare and Medicaid fraud. How are people doing this? How are they scamming us?
Well, recognize that we're almost $2 trillion in size, the largest agency by far in the federal government, so which means you've got the biggest target on your back. And foreign transnational groups, this one happened to have primarily Russian-influenced entities, get Social Security Medicare numbers, the Medicare beneficiary number. It's different from a Social Security number on purpose to reduce this happening, but they get that number and they hack into the system. And they get enough of these numbers that they begin to create fictitious businesses and pretend they're shipping you wheelchairs or oxygen or giving you, skin substitutes and all these procedures that are expensive. They charge that up to Medicare. And then by the time these agencies find out about it, sometimes it's too late. But here's the good news. We created a fraud war room, and we are stopping the money from going out the door. So in that $15 billion case where we arrested some people, many got away to Russia, but the ones we arrested, we were able to bring to justice. But what you really want to know is what happened to the money. And only $2.9 billion was stolen. I say only because it's ridiculous. That's a lot of money. But it wasn't $15 billion. So 20% of the money went out the door, gone for good, not going to see it again. It's in the Cayman Islands or in Moscow in a bank account or somewhere. But we were able to save $12 billion of taxpayer funds to take care of other individuals, like the two patients that your nurse friend mentioned earlier on.
I was reading that compared to adults born in 1950, those born in 1990 are twice as likely to develop colon cancer and 4 times more likely to develop rectal cancer. What is going on here, and what would you tell people to do when it comes to their health, and maybe even specifically their gut health?
Well, I'm a living example of this because when I was just before my 50th birthday for my TV show, I got a colonoscopy. And I did it to show off because you're supposed to get a colonoscopy when you're 50. Now probably 45 is more reasonable. Mm-hmm. And they found a adenomatous precancerous polyp in my colon. I mean, my goodness. I had done everything correctly. So sometimes because of the changes in the food, the toxins that might be in the environment, other environmental stressors, genes, for a bunch of reasons, some people are more prone to these colon and rectal cancers than others. So for whatever the reason is, colonoscopy both diagnoses and treats the problem. There are many other tests now, blood tests as well as stool tests that can help identify these issues. But the part of the deal with Medicare and Medicaid is it's a collaborative agreement. You're partnered with somebody else. This agency that you're, let's say, the Medicare, it will take care of you in your weakest and most vulnerable times. But you've got to chip in as well, which means preventive care matters. Eating the right kinds of food matters. It reduces, for example, the chance of all kinds of colon problems, including cancer. But it's also the same true as you've got to check yourself and test yourself and be aware of symptoms if they do occur. All that together makes a healthy healthcare system.
It seems like a lot of the cost-saving measures were put on your plate through Medicaid. I know how sensitive this topic is, but are you looking at other entitlements? Are you looking at Medicare? Are you making recommendations or planning to in terms of, I guess, reducing Medicare costs? I know that that's a very sensitive topic in terms of entitlements, but what is, I guess, next for you in terms of what you're expected to work with or cut?
Well, the president has been clear about loving and cherishing not just Medicaid, but Medicare as well. It is a program that works incredibly well. That's part of the reason I'm celebrating its 60th birthday, because I'm so proud of what it's done for our country. And I think Americans should appreciate how special it has been. Every program has points of weakness, but most of my goal is not to just drag the fraud, waste, and abuse issues into the forefront, is to make the system work better for the American people. Number 3 cause of death in America are medical errors. We're not empowering patients to be fully involved in their own care. We're not providing decision support to doctors to make sure that errors don't occur that could otherwise be avoided. We really haven't modernized the tech infrastructure of healthcare in a way that allows it to function like a 21st century business should function. It's one of the reasons that it's increasing in cost so rapidly, because it's inherently an inefficient process that we made even more inefficient by not addressing these. So the $50 billion infrastructure fund is our opportunity, a generational opportunity to get Medicare to get it to work the way it was supposed to work, which is to do things I've mentioned, but also do it with a tech-forward approach. Why are you writing your name down, your address, all your insurance information in every doctor's office? That should be automated. That's just emblematic of the kinds of problems we're facing. But I'll give you one concrete example. Prior authorization, which our listeners, it's the number one complaint people send me. They don't want to have the insurance company telling the doctor they can't do a life-saving procedure with you and keep you waiting months and months while they're trying to adjudicate whether you should get chemotherapy or not. So the insurance companies have to voluntarily, and I say voluntarily with quotes because they were, we did create an environment was easier for them to volunteer, but they, God bless them, volunteered to come together as an industry and clean up prior authorization. The number one obstacle they keep pointing to is that doctors don't work with them digitally. They send them paper records. It's very hard to adjudicate something quickly if it's on paper. Imagine your credit card, you put it in to buy a coffee, and it takes 2 weeks to hear back because the vendor's got to mail the insurance company a record of you putting your card in the machine. So it should be done within seconds, adjudicated digitally, like every other technology does right now. We will make that happen in this administration if I can help it.
Dr. Oz, thank you so much for your time. Appreciate it.
God bless you.